Good afternoon, everybody. Nice to be addressing you once again, on a topic that's very, very close to my heart. And that is the role of cellular therapy in neurodevelopmental disorders. Thank you, Chairman, for your warm introduction. I like to show this picture in many of my talks. I went to a hospital in a city called Howlin, Taiwan, run by Buddhist monks, and the entire wall of the hospital was this picture. That's all, just this one picture, huge, I mean, bigger than this room. So when I asked why you have put it here, so they said that this is a picture of Buddha going and helping to heal. And they said that the job of the physician is to reach out to people who need healing and help them. By the way, this hospital I went to is a unique hospital. Normally when you go to a hospital, the patient goes here and the patient goes there, patient goes everywhere. This is a very unique hospital. The patient comes to one place, everybody comes to the patient. The doctors come to the patient, and except for major investigations, the patient doesn't have to go. It's a unique hospital. The patient comes to one place and everybody comes, and that's why they've put this picture that the physician needs to reach out to the patients to offer them healing. Recently, and you must have read in the news, there was a concentrated attack on us to attempt to make us shut down our facilities. All right? Something which we defeated. When we did that, we got an instant stay order on it from the health minister. Not only that, the person who issued the order was removed from his job. All right? So we won because we fought. But I'm showing this picture to tell you that when that happened, do you know what our protection was? Our protection was our patients. We had this petition on change.org, and this is about a couple of weeks ago, and that time within a few days there were over 6,000 people who signed it. We had hundreds of letters that went to the Prime Minister and the Health Minister and the Commissioner. In fact, when we went to the Commissioner, उन्होंने हाथ जोड़ के हमको बोला, please ask your parents to stop sending emails because my email box is full and emails are bouncing. That is the power of the people. Okay, never underestimate that. Okay, when we are doing good work, okay, your strength, your protection is not your name, your reputation, your degree or your publications, but the patients who've benefited from your treatment, because everybody, right from the Prime Minister to the Health Minister to Commissioners, they listen to the voice of people. So that is something we should never ever forget. That is basically patients who matter. And all of us who do this work are going to face disruption, are going to face opposition, are going to face criticism. But anything that we do that is disruptive does cause that. The one thing we must do is to continue with our good work. Okay? Never let anything that people say make you take a step back. You have to continue movement, and you have to continue the movement forwards. You have to believe in yourself, you have to believe in the work that you do, and you have to believe that what you're offering is best for the patients. So, like I mentioned in my earlier talk, a lot of the criticism of cellular therapy is that there's not enough evidence. But in the work we do, for example, autism, there are over 30 papers, in cerebral palsy, over 40 papers. You can see spinal cord injury, head injury. So there are a large number of papers that already exist in these fields. So now we'll come directly to cellular therapy in autism. And the incidence of autism is completely going through the roof. As you can see, in 2004, 1 out of 166 children had autism, as per, these are US CDC figures. They're very accurate. In 2021, this has become 1 in 44. At the rate at which this is going, in another 2 decades, almost every alternate child is likely to have autism. This is an epidemic that nobody is recognizing, nobody is understanding, nobody is going importance to. There are multiple factors for that, and in this small talk I can't go into the causation for the increase. And we are seeing, in my own medical practice, remember as medical students, we hardly ever heard of it. Autism is mentioned in one small paragraph in our books, and today its incidence is really huge. Basically, there are 70 million people on the planet with autism. That's 1% of the world's population. That's not a small figure. 1% of the world's population today has autism. And Despite this increase, there is no treatment available. What patients do is they go to a doctor, a diagnosis is made, and they are just told take therapy and go back. That's it. No medical treatment, no surgical treatment, just rehabilitation, and these children continue to suffer. So the main problems in these kids are poor socialization, impaired communication, and repetitive behaviors. So currently these are all the rehab that are available, but they do not repair the fundamental damage in the brain. They only give some degree of symptomatic relief. So one of the things we did, and whatever clinical condition we treat, we don't just offer treatments and cell therapy, we understand, analyze, research on the natural history of the disease, its causation. At the back end, we have a huge research team that's headed by Dr. Himangi, who's sitting here. And everything is studied. So when we are treating these patients, that's the work happening at the back end. So this is a paper, it's a landmark paper, one of the first of its kind, published in a prestigious journal, the World Journal of Nuclear Medicine, which showed for the first time ever, and you'll be surprised, autism is so common, but nobody had described which parts of the brain are affected because nobody had studied them, nobody had done the scans. We actually did their scans, PET-CT scans, and documented and published this paper which showed which parts of the brain are damaged. And we also showed something interesting, that with age, the amount of damage continued to increase, the hypometabolism. So we saw something very interesting. We saw that with age, the SUV is the value on PET scan, with age between 5 to 10 years, the brain metabolism decreased as compared to typically developing children, which is the blue line, where the metabolism increases. What does this mean? This means that the earlier you treat, if you treat patients at an early stage, all right, you only have to bridge this gap. The longer you wait, the longer is the gap to bridge. So like any other disease, whether it is cancer or diabetes or anything else, the later you treat, the less are the results. That's why the urgency that this treatment should be made available, because the longer the children wait, the lesser are the results. So we identified which parts of the brain are damaged. All of them, the amygdala, the hippocampus, the parahippocampal gyrus, cerebellum, caudate, mesothalamus, all these areas. This had not been shown before. And we've shown the world, hey listen, these kids have got brains that are damaged, that are hypometabolic, you need to fix them. You cannot be giving therapy on a damaged brain. Would you, for example, if a child had a fracture of the leg, would you give physiotherapy on a broken bone? You would not, right? You would fix the fracture and then give damage. And what we are doing now, we are giving therapy on this damaged brain. And this damage can be corrected. So again, we actually saw in our paper that depending on the grade, the type, if in milder autism the damage was less, in moderate the damage was more severe. The blue, green, yellow is normal, the blue is hypometabolism. So there are major unmet medical needs, because whatever treatments are there don't fix the underlying damage. We know the problem at a cellular level is hypoperfusion, decreased oxygenation, problems with the immune dysfunction, and cell therapy, by virtue of the qualities they have, they help to fix all of these. So the world's first scientific paper on cell therapy in autism was published by us. This is autologous bone marrow mononuclear cell therapy, an open label proof of concept study. The second paper came from China, the third from Italy, and the fourth and fifth have come from Europe. So this is landmark. I'm not sure there is any other medical condition, there may be few from gynecology maybe, but where the first paper has actually come from India. Now, if you review all the papers, then there are a total of 33 papers, the total number of 461 patients, of which 359, that's 80%, have shown improvement. This is a systemic review of all the published work. So this is our first paper, which was published from India, and this was 32 patients, follow-up of 12 months, and 91% of the patients improved. And we use autologous bone marrow-derived mononuclear cells. This was the second paper from China, Yong Tao et al., and this was 37 patients. They used intravenous and intrathecal umbilical cord cells and cord blood cells, 88% improvement. This paper from the United States by Dawson, they use umbilical cord cells, 25 patients, 90% of the patients showed an improvement. This other paper from the United States, Kimberly, 25 patients, autologous umbilical cord use, 90% of the patients improved. Martinez from Mexico, 24 patients, again 95% of the patients improved. Tan from Vietnam, 30 patients, again 93% improvement. Italy, Bradstreet, you can see 45 patients, 78% improvement. So there are papers from across the world that are showing anywhere between a 75 to 90% improvement. Then there are, of course, meta-analysis and systemic reviews. So this is a meta-analysis of 461 patients from 11 published studies. And the conclusion is it's safe, it clinically improves patients regardless of the cell source dosage, and there was a significant improvement in all the scales. So this is a systemic review or a meta-analysis that is showing improvement. This other systemic review, this is 325 patients. Again, it is safe and effective, and that the CAR scores of patients reviewing cell therapy were higher in the treatment as compared to the control group. Now this is our subsequent paper. This is 254 patients. We followed them up over a period of time, 7.5 months, age 2 to 34. And here you can see it's a little crowded slide, but this is just showing you the different improvements in social interaction, eye contact, attention, stereotypical aggression, hyperactivity, self-injurious behavior, sitting, command following, speech. So all these things, you can see the percentage of improvement in the symptoms. And these are the scores, the ISA score and the CAR scores. These are objective scales. You can see 94% and 95% improvement. And what we found was that the improvement changed with age. So in children below 5 years, 97% improved. Between 5 to 10 years, it was 94%. And as the age increased, the results became lesser. So in 15 and above, it became 91. So this matches with our study that the damage increases with time. And so the earlier you treat, the better it is. So, and now to show the objective proof. So there you can see above, you can see the PET CT scan. The blue is the hypometabolic area, and this shows the part that's damaged. And below you can see the hypometabolism has resolved. So I'm just showing you 2 or 3, but we have almost 2,500 scans of patients before and after showing this improvement. This has never been shown before in medical history anywhere in the world. The fact that the brain damage in children with autism can be reversed by autologous stem cells. So here again you can see above the damage, and this, by the way, these are done on a Siemens machine. That's why I've written on top, because the Siemens PET scan is different. This is also on a Siemens machine. Above you can see the damage, and below you can see that the damage is gone after cell therapy. And this is on a GE machine, General Electric. So two different types of machines, they show similar results. So you can see before, this blue is all damaged, and after the cell therapy you can see the green, or the recovery has happened. So these are objective scans on Siemens and GE machines which very clearly show that the damage can be reversed with cell therapy. Now, apart from a publication in papers, we also have, there's this textbook, Recent Advances in Autism, where they introduced a chapter, Stem Cell Therapy in Autism Spectrum Disorders, and they asked us to write this chapter. So now, books on autism are introducing chapters on stem cell therapy, and they happen to ask us to write them because we have the largest number of papers. And we have a total of 16 scientific papers. Here's just a small little story of this child from America whose father was a cardiologist, mother was a nurse.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. Or he had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about Neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
Started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone
This is
from
very important. From the
third
third grade,
fourth month reading level to a seventh grade first month reading level in 5 months.
See, from third grade reading to seventh grade in 5 months after stem cells. And now he's getting A+ everywhere. He's topping his class, his autism is reversed, and this child is today completely normal, has no evidence of autism, and is traveling all over the world alone. He travels with friends. He's completely off the spectrum, from no speech to full speech, from a special school to not just a normal school, but topping in a normal school. And he's the son of medical, a cardiologist, and I just showed you just one case as an example. And very quickly to run through cerebral palsy. Now in cerebral palsy, the damage is more severe, as you can see on this PET scan, and the problem is more in the body. In autism, the problem is in higher functions. In cerebral palsy, it's more spasticity, difficult in movements, and you have some drugs, anticholinergics, various orthopedic and neurosurgical procedures, but they don't fix the damage in the brain. So there are major unmet medical needs, because all we can do is give some symptomatic external relief. And this just shows how stem cells work. It shows what are the problems in the CP brain and how injected stem cells help. There are a total of 44 papers worldwide, 1,971 patients, of which 1,736 improved. That's an 88% improvement in a condition that's considered to be incurable and untreatable. So our results, this is our paper. This is not the world's first paper, but this is our paper first, and 40 patients follow up for 6 months. And you can see the percentage of improvements in oromotor, speech, sitting balance, standing balance, walking balance, ambulation, leg movements, overhead activities, distal hand movements, muscle tone. You can see, everything from trunk to option. So everything sort of improves. And this is the results in diplegic CP, and then these are the results in quadriplegic CP. And these are the results in miscellaneous CP, more or less similar kind of results. And this is objective evidence of the fact of brain. Now look and see the brain damage, okay? This is before. You can see how much of the brain is hypometabolic. Post-treatment, it's gone. It's normal functioning brain, all right? This has never been shown before in medical history. For the first time, we are showing the world that the damage in children with CP can be repaired. This is objective. We don't have one or two. We've got in thousands of these scans, before and after. And this is again to show you the, on a different, that was on a Siemens machine. This is on a General Electric machine. Similar, you can see this. See the damage here before. You can see all this blue, hypometabolism. And you can see the brain function has come back in the same child. Machines tell you facts. Machines don't make up facts. They tell you 1 + 1 is 2. And these are both GE and Siemens machines telling us that. We have a total of 15 scientific papers on cerebral palsy. And this is a child from Kenya. You can see he was severely spastic, totally wheelchair bound, could not move his hands and legs at all. And now you can see that he's able to use his hands, he's able to wear his shirt and clothes, and able to pack a bag. This was all impossible. There was no movement at all. This was very emotional for the mother. The fact that he can open a fridge, take out a bottle of water and drink it. Now only a parent can understand how important that is for the child. And there you can see now he's walking. A totally wheelchair cerebral palsy patient. This patient was from Nairobi, Kenya, is today walking and independent. The last topic is intellectual disability. This was earlier referred to as mental retardation. We now call it intellectual disability. There is not much that can be done in these patients. This is just to show you the mechanism of improvements. And we've again studied which parts of the brain are affected. So, it's very important that when we do cell therapy, we also keep on studying what is happening to the disease overall, so we can help in many other ways as well. So these are the results. Again, this is the world's first scientific paper that we've published. And this was here there was a control group. So we had 29 patients who took cell therapy and 29 patients who took only rehabilitation. And here you can see the dramatic difference. The blue is the patients who took cell therapy, and the orange is the one who took only rehabilitation. And you can see 55% improved in cognition with cell therapy as compared to 17% in the control group. Same thing you can see remote memory, 88% improvement in remote memory as compared to 12%. So dramatic difference in both the groups, in the self-treated group and the control group. And this is again before and after. You can see the amount of hypometabolism above, it's all blue, the brain is hardly functioning, and post stem cell you can see the entire brain has got activated. So we've got 4 papers on intellectual disability. So coming to complications, we've had no major adverse events or complications. No patient has deteriorated neurologically, but we do have 3% of our patients who develop an increase in epilepsy. These are kids who already have epilepsy. 10% of our patients have a spinal headache. This is a headache which is peculiar. It comes only on sitting up, on lying down it goes away. This is not because of the stem cells. This is because of the lumbar puncture. And some patients have nausea, vomiting, etc. Now, we've published this. People only publish their good results. But true science is when you publish your complications also. And there's only one paper in the world which is published on adverse events, and that paper is published by us. We've published a paper, Seizures as an Adverse Event in Cellular Therapy. It is important that we document our results, adverse events, that we publish them. So we let the world know. And when you publish them, you can do something about it. Most people, it's human tendency. If you have a complication, you want to push it below the carpet. You want to pretend like it didn't happen. No. We document it, we make a note of it, and because we study it, we can improve. So in this paper, we had actually reported a 6% increase in epilepsy. But because we identified it, we now have a protocol of adding an anticonvulsant. We've been able to reduce it to 3%. So when you're honest, you can actually reduce your adverse events. So we've treated over 12,000 patients now from 75 different countries. Okay, there was a time when patients from India went overseas. You heard of people who could afford it, and now the thing is reversed. And this is emotional for me. I remember 1995, I was in England in Queen Square training in neurosurgery. I was doing my post-qualification training, and after I finished, my boss offered me a job. I was working on a salary of 7,000 rupees, and the job offered was 3,000 pounds. It was huge, a huge amount. And he told me something, why are you going back? You'll be wasted in India. And I remember it was in the operation theatre. I so clearly remember. I looked up at him. I don't know how I said it. I said, I'm going back to my country to serve my people. But one day people from your country are going to come to my country for treatment. And I remember everybody laughing, ha ha ha, see what he's saying. But I've made it happen. Not only patients from England, but patients from the United States and patients from all the 6 continents of the planet now come to India for treatment. So this is important. It's a matter of pride for us. So we have a total of 106 scientific papers in peer-reviewed journals. We have 16 books, and all our books are distributed without any cost. So we have books for doctors, for therapists, parent guides, all of them. So my conclusions are that adult stem cell therapy may be considered a safe and effective, remember I'm putting safe before, it's safe and effective treatment option for autism, cerebral palsy and intellectual disability. What it does is it accelerates development, reduces disability and helps functional recovery, basically helping improving the quality of life of the patients. Thank you for your attention.